Hi, I'm Brian Crombie, and we're going to be talking on The Brian Crombie Show. We're going to be talking about politics, arts, business, and social issues on The Brian Crombie Show on Canada One TV. Good evening. Welcome to The Brian Crombie Show on Canada One TV. I've got an interesting interview for you this evening with Ken Greenberg, who is a renowned urban thinker in Canada. Recently wrote a book called The Walking City, and Jennifer Keesmaat, another urban thinker who was a former candidate for mayor, former chief planner for the city of Toronto. Both of them renowned people within Canada, if not the whole world, about what's happening on urban issues. And they both address the issue of how our city is going to change with COVID-19. A lot of people have been concerned that downtowns will hollow out, that people won't be using transit, that people are going to go back to cars, that density has been an issue. And they refute a lot of these and come out very supportive of cities, but renewed cities that are walkable, livable, and sustainable. This is as part of a continuing series of interviews and meetings that we have for Transit Alliance, a civic advocacy organization here in the GTA, Greater Toronto Area, that I am honored to chair. I bring you Ken Greenberg and Jennifer Keesmaat. Thanks for joining us.
We've heard in some quarters that density is the problem, and this will give rise to a new exodus from the city, worst case, getting us back in our cars, and pushing us towards greater sprawl. Secondly, a worry about transit, which we're all staying away from now, and which obviously has to be maintained so that when we come out of this, it is available to us, and critical transportation projects like, for example, in Mississauga, the investment in the LRT coming up here, Ontario, are things that we absolutely must not walk away from. I think we're learning that one of the keys to resiliency is social equity, and the way in which the pandemic has revealed vulnerabilities is making that abundantly clear. Another thing that I've started to think about and talk about is value engineering in redundancy for resilience. Value engineering, for anybody who's involved in development or construction, is usually a process that you go through when you're trying to cut down a budget which has become too large, or a project that's gone over budget, by taking things out. I think we need to think about redundancy as something that is essential, and making sure that we have alternative ways of accomplishing things in the event of something like a pandemic. And finally, the learning that's going on now from improvised pilots on the fly as we adapt to changing circumstances. We can go to the next. Thanks. So from a public health perspective, what's really interesting is two different issues surrounding health have overtaken each other. One is the early part of the 20th century, which you see on the left, when people were living in tenements and there was great concern about infectious diseases, and then a new public health crisis, which came about as a result of an auto-oriented, ubiquitous suburban form of development in the post-World War II era. And if you switch to the next. So going back to that period coming out of the Industrial Revolution, when public health was a major issue, there was a strong reaction to overcrowding and the unhealthy overlap of living and working in toxic environments where people are living near factories, and you can see the kind of images and the overcrowding that's going on in this image. And then next. So in the post-Second World War era, we have a different set of health challenges, mostly related to our over-exuberant use of the automobile. So Life magazine cover from 1960, which shows that the interstate highways in the US filled up as quickly as they were built. We didn't really understand the impacts we would have on the atmosphere and reducing climate change. We certainly didn't understand what it would do to our health from a medical standpoint in terms of obesity, heart disease, hypertension, and so on, and particularly among children who no longer walk to school or rode their bikes to school or being driven everywhere. And then with the advent of screens, that was exaggerated even further. Next. Can we go to the next image? So this is a really interesting graphic that Peel Region Public Health put together called Health by Design. And they portray these two types of epidemics, the 19th century epidemic on the left and the 21st century epidemic on the right. And the things we were concerned about in the 19th century, which largely had to do with the transmission of infectious diseases, and the response had to do with clean drinking water, sewage, ventilation, public parks. The public park movement got a great boost from that. And then when we switched to the 21st century, this is before COVID that they produced this graphic. We were talking about chronic diseases, diabetes, cardiovascular disease, and so on. And they identified the policy response to the 21st century version being healthy, compact, complete communities, supporting increased walking, cycling.
How come you had an answer soon?
Sorry?
Sorry, could everyone please mute their microphones? I think there's a little bit of interference.
So you can see the little box that I created around the policy response, and they're identifying the fact that community design was powerful in both situations, changing the way we made cities in effect. And I've added the little yellow thing above that to say that COVID-19 is actually tying these two things together. We're now back to looking at infectious diseases, and at the same time, we still have the 21st century epidemic related to chronic diseases. So in a sense, we're dealing with both things simultaneously. Next. So this public health, and I don't know if you all know this, but I've been literally embedded with the city of Brampton, your neighbor, for the last year, working with them on their 2040 vision and a whole series of developments throughout the city implementing that vision. And I find myself working more and more with Peel Region Public Health, Lawrence Lowe, whom you may know, who was responsible in part for putting together that graphic I just showed you. So this is the City of Toronto Public Health weighing in on the issue of walkability related to those kinds of diseases that were identified as part of the 21st century epidemic. And you can see that basically the pre-war City of Toronto, which is in the light yellow color, is where people walk. And the further you get away from that, you end up with that form of disease. Now go to the next graphic. And lo and behold, COVID cases are occurring in exactly the same places that were vulnerable in terms of those chronic diseases. And what we're understanding now is that the numbers are showing us that it's not density, because the densities are very similar. It's actually poverty that is where we're getting the locus of the highest amount of vulnerability. Next. So putting that together, we are collectively, anybody who's in my field of work, and I assume from your organization, you're thinking much the same way. By the way, there's the L got lost in placemaking. It's not healthy pacemaking. But this really illustrates the kind of paradigm shift that we're essentially trying to make to get to walkable. We now refer to 20-minute neighborhoods where people have access to the services, to things they need in the course of their daily lives. They have alternative ways of moving around the city and we're weaning ourselves from that excessive dependence on the private automobile. Next. So speaking to density, this is a little plug for the Ryerson City Building Institute, and I would urge you to go online and find this report called Density Done Right, which the City Building Institute just put out. And it's really talking about how do we get away from what we call tall and sprawl, the two extremes of density, extremely high towers and sprawling, very low density, auto-oriented, and get to a distributed form of density, which is not just about buildings, it's about buildings along with social infrastructure, services, places for community life, and so on. Next. So I pulled this quote out from Jane Jacobs' Death and Life of Great American Cities, written in 1961. And it's interesting that even then, she spoke to the confusion between density and overcrowding. Overcrowding, which you can have at very low density, is really the place where people are most vulnerable to the pandemic. And so she's making the case for good urban density that's sufficient to give people the kinds of things they require in order to live in walkable, sustainable communities. And so she devoted the better part of a chapter in that book to clarifying that misunderstanding. Next. What we're learning is that micro communities as social networks are a great source of resilience when we're faced with crises like COVID-19. An interesting example, in 1995, there was a terrible heat wave in Chicago, and a study was done comparing the mortality rates in different communities in Chicago. And what was discovered in communities which had all other things being equal, similar demographics, similar income levels, the communities where people had strong social networks survived that heat wave much better. The rate of morbidity was much lower because people were looking in on each other. They were looking out for each other, particularly seniors. And the lack of social connectivity became something that was a cause of very serious vulnerability. Next. So these are some images from places where I'm currently working with Brampton on planning for this new form of development related to their 2040 vision. On the right is along Queen Street, east of downtown Brampton, 3 kilometers, where a series of 20-minute neighborhoods are being planned to replace strip malls and power centers using a development permit system. And that work is well underway, anchored by what you see in blue, which is that series of community hubs combining schools, libraries, community centers, and the whole array of social services. And coincidentally, we're working with Peel Public Health on incorporating public health facilities or health facilities in those community hubs as well. On the left is your Ontario. So the extension of your LRT getting up to Steeles in the first round, which is that major intersection, and eventually continuing up to downtown Brampton. Shoppers World, which you probably know, is an area where RioCan, well-known mall developer, is converting a 60-acre mall into a new neighborhood for 23,000 people at the intersection of Steeles and Hurontario. And Kenneth, their neighbor, is doing the same thing with their strip malls and their tower sites. So that whole area is being redeveloped following this pattern that I've been describing. Next. We're also learning, and this is where redundancy comes into play, that having more space, literally the ability to spread out, to get beyond very narrow sidewalks, dangerous conditions for cyclists, as cities around the world are turning on a dime and taking away lanes of streets to create additional space for pedestrians and active transportation. And I'm virtually certain that much of that will remain, the most ambitious being Paris, which is creating 650 kilometers of new cycle lanes. London claims to be doing even more. Montreal has done something like 250. Toronto has done a mere 40. But knowing Toronto, this is a big deal, which we're very proud of. It's a big jump. Keep going. We're also seeing that this ability to, in this moment when we're all anxious about using public transit and we don't want to force people back into their cars, introducing what we're doing in Toronto along Bloor Danforth, University Avenue, and a number of other places, is following the subway lines so that people who are using the subway now have a way of getting around using cycling, using active transportation. And this is leading to something which I'll show you in a moment. Next. And here's a remarkable thing. What we've seen now in the last 10 weeks is a reduction which has been estimated at something like 17% in the amount of CO2 emissions. So this is the most extraordinary reveal showing what would happen if we were actually able to move away from the extreme dependence on fossil fuels. And we can see it quite literally in cleaner air, cleaner water, the sounds of the city that we didn't have before. It's tangible. And I think people are understanding that and not wanting to simply go back. Next. So I mentioned what was happening in Toronto, the 40 kilometers of expanded bike routes. And next, in the next day or so, this is going to be released. This is a group of NGOs I've been working with, including Spacing Magazine, Park People, Cycle Toronto, Walk Toronto, and they've all gotten together to produce this map. It's an app that you will have on your phone, whether an iPhone or an Android, which will show this emerging network of Safeways, and it will track all of the additions to these safe alternative ways of moving around the city. And it really has two purposes. One is to help people in navigating the city as it is today and as it's emerging, but it's also a form of advocacy, mobilizing people to do more and more of this. And I think you can't help but notice when you look at this map that the safe ways are concentrated in the pre-war city of Toronto, and where there is a dearth of them is in those very areas that were vulnerable before from a public health standpoint with chronic disease, and now are vulnerable in terms of infectious disease, which are the northeast and northwest parts of Toronto and Scarborough and Etobicoke. And so the big goal here is to extend those networks through a suburban environment. And that, by the way, is not unlike the kind of challenge that I'm dealing with in Brampton. So that was, okay, I have a couple more slides. Next. This is from the window where if I look out the window as I'm talking to you, this is what I see outside my window. This is in King Spadina. It's an area called Wellington Place. And what we've learned is that walkable mixed-use neighborhoods have the very characteristics that make them resilient, both in terms of the previous public health crisis and the public health crisis that we're living through now. Next. And this is the final image. And if I look out my window right now, I see a scene which is just like this photograph I took a few days ago, where people are actually using the parks. I have never seen so many people walking, cycling, and using park space as we see now every single day. And in this case, having this little park, Victoria Memorial Square, enables them, even without the circles painted, to space themselves out nicely in their family groups. We have not had the problem here that we had in Trinity Bellwoods a weekend ago. And this has really made people more determined than ever to both expand the networks of the Safeways, but also take advantage of more green space throughout the city. So that's really a setup just to start the discussion. I'd love to hear your reactions. Does this resonate with you? Does it make sense in terms of what you're experiencing or what you're dealing with? Maybe we just use that to kick off the discussion.
So maybe, Ken, I could step back in and apologize I wasn't available to welcome you on the call to start with. Remind everyone if they could mute their phones, I'd appreciate it. Jennifer Keesmaat's going to join us in about 5 minutes, and she's going to have her own angle on things about in regards to how things are going to change in our cities. Ken, in China, as they've reopened, supposedly transit ridership is down dramatically, something like 40%, and car ownership is up dramatically as people don't feel safe in transit. What do you think is going to happen in Toronto and in urban North America?
Well, I think there are going to be a temptation to go both ways. I think we are, on the one hand, seeing an explosion across North America of active transportation like we have never seen. And on the other hand, I think some people will be tempted to get back in their cars. I do think the avoidance of public transit is going to be a temporary phenomenon. It may take a while, but once we have a vaccine, I think the fear of public transit is going to be much less. I personally, I use the GO train. Every time I went to Brampton, I would take the GO train. I use the TTC in Toronto. I'm not doing that now. I'm cycling everywhere. Obviously not going to Brampton cycling. But I think that my belief is that the move to active transportation, which is literally happening in hundreds of cities around the world, is going to remain with us. I sincerely hope we don't get back in our cars, because the truth is climate change is a much bigger existential threat than the pandemic. This is the one that we're really all facing together, that has been in a way subsumed by our attention to the pandemic. But if the result were that it pushed people back into their cars and pushed us back to sprawl, this would be devastating. And my belief is that I don't think that will be the outcome. Now, China and India are an interesting case, because not that long ago in a city like Beijing, cycling was the major form of transportation. And the push to get people in private automobiles is relatively recent, but enormous. And you have to wonder what this, I mean, obviously they have fantastic transit systems as well, but what this is going to do to that reliance on the automobile, given the fact, what's really interesting is if we're experiencing a change in terms of air quality, they're experiencing that change even more dramatically than we are. Seeing clean air like they haven't seen for, I don't know, a decade or more. So it'll be really interesting to see how these two pushes and pulls play out.
So I think you wrote and published a book called The Walkable City a few years ago. Has your thesis changed because of COVID-19, or based on all the slides you've just walked us through, if anything, what you've done is you've amplified your belief in the power of the walkable city?
Yeah, I absolutely. I'll steal a phrase that others are using. COVID-19 is a particle accelerator. It's both shining a light on our vulnerabilities of all kinds, everything from how we do long-term care to how poorly we paid people, and people working part-time jobs without benefits, who's being affected most by COVID-19. And it's interesting that Peel Region, like those parts of Toronto, Scarborough, and Etobicoke, is being dramatically affected because a lot of the people we're talking about as heroes, new immigrant populations, people who are living sort of paycheck to paycheck, are the ones who turn out to be most vulnerable. So it's shown a light on those inequities, but it's also pushing governments at all levels to do things that nobody thought could be done very, very quickly in terms of dealing with homelessness, getting people off the street into hotel rooms, into various other buildings. I think it will cause a radical shakeup of care of seniors in this province. I think it's going to do a lot of things that I talked about in Walking Home, but cause them to happen more dramatically and more quickly. I also want to say, I can't help saying this, how Canada is experiencing this is so dramatically different from what we're seeing south of the border. Who would have believed that the face mask could be politicized and weaponized? I mean, we are seeing, and the fact that we now have the president of the U.S. threatening to turn the U.S. Army on its people is just terrifying beyond belief. And I fear for our neighbors to the south and what's happening in their society and the way it's being torn apart. And I can only hope they find a way to vote this monster out of office in November. I think they are in peril, and I don't mind saying that. I think we in Canada can't be smug about some of the tendencies that have caused that kind of reaction in the US. They're not here to anything like that extent, but the points that are being made by Black Lives Matter, we're not immune to those things, as you know well, when you look at what happened in Peel Region with the Board of Education. Those things are among us as well. So I think we can't avoid that now being part of the conversation as well.
Most of Transit Alliance members that you're speaking to today have some involvement in the transit industry, either by way of construction or development or design, architect, etc. What do you think they need to hear from you in regards to how they need to change? Are transit designs going to change? Are buses, GO trains, etc. going to change? Or is it just going to be cleanliness? What do you think we need to be wary of and planning for?
Well, I think it's a few things. I mean, the first thing is we have to make sure that we keep the systems we have intact. The deficits that, I'm more familiar with the numbers around the TTC. Metrolinx, I suppose, is much the same. Devastating, absolutely devastating. And we have to make sure that we have federal and provincial support to keep those systems operating. We have to keep on with the $50 billion investment we're making in Ontario in expanding all-day GO service throughout the GTHA, electrification, and light rail, all of the things we're doing anyway. It would be absolutely self-destructive to move away from that. I think in addition, there will be design changes. I'm sure many of you probably are more aware of that than I am. Going to the issue of redundancy, going to the issue of having multiple ways of making trips, so that if in the event of system failure or system breakdown or vulnerability, we can pivot and have other ways of making up the difference. That's always been the case, but I think it probably is even more significant now.
Excellent. Thank you so much. I think Jennifer Keesmaat has joined us as well. Jennifer, are you there?
Hi, everyone.
Hi, Jennifer.
Jennifer, we've just had an excellent presentation by Ken Greenberg that I think you've seen a copy of, that he's walked us through his thesis. You've recently released I guess it's called a manifesto. What do you think the future of cities is going to be like post-COVID-19?
Well, we called it a declaration, but to be honest, that was the will of the majority. I wanted to call it a manifesto. It really is a manifesto. And the truth of the matter is our cities are going to be what we make them. Our cities will be whatever we choose in this moment. And the question is really what we will choose and whether or not we'll choose something for our cities that is forward-looking, that is based on what we understand about disease and contagion and the opportunity to create places that are fundamentally and inherently healthful. I've been making an argument not dissimilar from the argument that Ken has been making, that density and good density in particular is not something that we should wholesale abandon in this moment, but ought to be something that we go even deeper into, that we embrace good density even more so than we had in the past, precisely because we need good density, because good density leads to health and is directly connected to creating societies that will have resilience from a health perspective. If our goal is health, then we want to design our cities to be places that are healthful. And the risk, of course, is that there's a reaction to density, a reaction to urbanism that is not founded in fact, but is instead ideological, I guess, is the only way to put it. The good news is that we know that there is no correlation between contagion and density. It simply doesn't exist. If you look at if there was, on the face of it, you could look at the densest cities in the world and they would have the highest rates of contagion. And we know that isn't true. We know that Singapore, Seoul, Korea, Hong Kong, very dense cities that in fact did an exceptional job at mitigating and stopping contagion. And we know that some of the ways that they were able to do this had to do not with the design of city at all, but with government response. So the preparedness of government had an impact on whether contagion spread. The timeliness of communicating to the public, the clarity of the message that was communicated to the public, and of course the compliance of the public had an implication on contagion. But some very simple things that we didn't do here, they did in Seoul, Korea, and Singapore, for example, meaning that if someone went to the hospital and was tested and was diagnosed as having COVID-19, they didn't leave the hospital. They didn't go back into the community. That did not happen here. Here, not only could you not get tested, but you went back to the community. So I only say that to stress that government response is the foundation of the extent to which we've seen contagion. And it's important to have clarity about that, because in the absence of that clarity, we might be tempted to blame city design or to blame density. And in some ways, it's a little bit intuitive that we do that, because in the absence of data at the outset of lockdown, we were all told, stay home, shelter in place, social distance, ensure that there is a minimum of 6 feet between you and anyone else. And that was because at that time there was concern about contagion taking place when a jogger ran by you or you passed someone on the street. We now know, because we've got data and analysis in particular that's been emerging out of China, that it is places, and we have the same outcomes here as well, it is the places where there are shared surfaces and shared facilities where contagion has taken place. So that's why we see, and there's a whole series of other complex factors. I don't want to reduce it to this, but nursing homes are places where there's shared surfaces. Prisons are places where there's shared surfaces. Meat processing plants, there's a tremendous number of shared surfaces. Those are places where we've seen a high level of contagion. Even after lockdown, we know from data that has come out of New York City that 61% of new cases have been transmitted by people that have been in lockdown through their immediate family. So again, reinforcing people are not in fact getting COVID-19 by walking past someone on the street, which has also been, of course, now affirmed by our public health officials. And the first public health official to speak clearly about that was Dr. Bonnie Henry in Vancouver. So now that we know that, it raises questions about how do we live in the future? And we know that crowding, which is sometimes confused with density, and I think Ken probably spoke to this in his presentation, is a real issue. And there's a risk because we cannot have density without having public transit. The two are conjoined. But we've underinvested in transit. Everyone here knows that. And as a result, we do have a tremendous amount of transit crowding. And there's a risk. And we've now seen a correlation in the city of Toronto between some of our busiest transit routes in the areas where there's the highest level of contagions, in particular in vulnerable populations. So it raises a question for us when we think about both the in-between phase, this phase we're in right now, where we're sort of coming out of lockdown. We still have new cases rising every day, but we're looking to the future and wondering what the future looks like. We know that we need transit as an essential service. We've created dense urban environments that rely on transit, but we cannot accept crowding on transit in the way that we have in the way that we have in the past. I'm coming to you from a call at MIT, and the head of the Boston Transit Agency was on that call, and he was talking about the strategy that Boston is seeking to employ to get through this next phase, but also what they're looking to in 2020, 2021, and 2022. And there's some very interesting considerations, I think, for transit planning moving forward in the future, in part that he raised. The lines in the city that tend to cater to white collar workers are now today only at 4% ridership. Isn't that incredible? Just 4%. Because white collar workers largely have been able to stay at home and haven't needed to go into the office. The lines that cater to, and he says their rush hour patterns have completely changed, and they now correspond to shift work at hospitals. And so the lines that cater to health infrastructure in the city are having challenges with crowding, but only because there's still social distancing. So those lines are up near 20%, in some instances 30%. As we look to the future, both coming out of lockdown and the future city, we have some really critical questions to ask around ensuring that our essential workers and our most vulnerable workers can continue to access service that they need in a way that is safe, that does not result in crowding. And some of that can be done at the operational level by thinking about operations in a different way. So those so-called white collar lines, which in many ways speaks to a failure of city planning and a failure of creating mixed use neighborhoods. Those lines, they're looking at reducing the service, and they're trying to figure out if there's ways that they can take some of the transit ridership on lines that are under capacity and shift the overcapacity, changing the route patterns to shift around some of the capacity within the system. So I think these are some of the really technical considerations that are going to be a part of thinking through how we continue to execute a high level of transit service that meets the need where it is the greatest at this moment in time.
Could I ask, frankly, both you and Ken? Ken had a chart that showed where the pandemic had hit in Toronto. If you took away your international examples of density, you mentioned, Hong Kong and Singapore, et cetera, and focused only on North America, I think that you would see that density has been where the pandemic has occurred. That said, it hasn't necessarily been in the downtown, most dense areas, but it's been in the poorer socioeconomic areas. So, the epicenter was Queens, as an example, which isn't as dense as Manhattan, but it is still dense, but has a far lower socioeconomic situation. What would your solutions be to that situation? Ken mentioned, this is certainly elevated concerns regarding the housing crisis, but what else do we need to do?
Well, first of all, just to go back to the assumption that you raised, it's actually not true. There isn't a correlation between density, even in Toronto. There's no correlation between density and contagion. There is a correlation between lower income communities and contagion, and the same exists in New York City, for example. But even if you look more broadly in in New York State, some of the worst hit areas are not areas, they're quite suburban, quite frankly. They're areas where people live in single family homes and drive cars. Detroit has been hit very badly. The correlation that is unquestionable is socioeconomic and contagion. It's not density and contagion. If it was, Manhattan would be worse hit the worst hit part of New York, and it's not. Manhattan has the lowest number of cases of all of New York. So it's really critical to be clear about that. Where have we been hit worst? Well, one of our first outbreaks was in Bobcaygeon. Bobcaygeon is a resort town without a single tall building. There's no community density. But of course, it was in a facility that is within those four walls relatively dense, but importantly had a whole variety of other issues, but one of them being that there's shared surfaces in old age homes. But it was Bobcaygeon. It's a town of 2,500 people. So I think it's really important to be clear about that, because the risk, of course, is that we start upending our city building in ways that actually don't flow from the logic of the problem we're trying to face. And on the other, sorry, Ken, go ahead.
Go ahead, no, finish.
I was just going to say, and on the other side of that, we also know that it's what I've been calling it the indoor-outdoor paradox, which is that we know and we can trace contagion to indoor contexts, but they have not been traced to outdoor contexts. So the primary transmission has been in environments with surfaces. I think for our definitions, transit actually falls into that. When you go into transit, you're within a closed space and you're touching the poles, you're touching the seats, but outdoor transmission is not something that has been documented.
Yeah, I was just going to say, it's interesting that in our province, there was a reluctance up until very, very recently to actually reveal where the pandemic was affecting people and to develop statistics that would show us that. And finally, we're now seeing that both geographically, but we're also seeing it in terms of who. And so not surprisingly, it's new immigrants, it's racialized communities, and it's poor people. And the reasons why that's happening is they're living, whether at low density or high density, they're living in overcrowded accommodation. And they're the ones who have to, what the statistics that you were quoting, Jennifer, about the use of transit in Boston, the people who have no choice but to go to work a certain way and who are being put in unsafe conditions in factories that open prematurely. So there are a whole bunch of factors, and they all point to inequities in the way we've organized things in society. The most extreme being the way we were warehousing seniors and treating seniors. So I think the learning from this, it's a horrible way to learn things. If anybody's a structural engineer, you're familiar with how you do stress tests with concrete or steel. You keep loading beams until they fail, and then you see how they fail. I think what this has been is a stress test for society, and it's showing us where the cracks are appearing and where we've, through omission or commission, we've done things that have made us extremely vulnerable. And shame on us if we don't take advantage of that learning to do something about that.
I had to go downtown to my office downtown for the first time last week in 2.5 months, and it was like the zombie apocalypse. There was no one around.
No.
What's going to happen to downtown Toronto?
That is a really interesting question. I'm looking out my window at a big tower that Shopify is building, and they were proposing to occupy the entire tower. And I'm saying Shopify because they've just said to their employees, you don't have to come back and work in office buildings. I think this is my crystal ball. I think the first part is easy. There will be a lot more people, at least some of the time, working from home, using media like we're using now to do things. That seems clear. But I think ultimately, again, once we have a vaccine, the desire for people to be together in physical space and to interact with each other is going to come back. I remember after 9/11, when I was doing a lot of work in New York City, there was a real fear, for example, that people would not want to be in the city. They would not want to be in public spaces. They wouldn't want to be with each other. Well, guess what? It didn't take long until the city was thriving again. I think cities have such a lure for people to want to have that sense of interaction, that personal contact. I think if anything, this has made us all sick of living digitally. This has been the acid test, all the speculation of, could we abandon the physical world? Well, guess what? We're plunged into it, and it ain't that great. And so I think we'll see a sorting out. We'll see different companies responding different ways, individuals responding different ways. But I think ultimately we will come back to people living in cities, in dense, well-made communities, and working in them as well.
What about regional malls?
They were a dead duck before, for a whole set of different reasons. And this has just added another. I mean, the fact I told you about RioCan and taking apart Shoppers World. And by the way, in Bramalea, Morguard is picking off the anchors and disassembling that mall. You've seen some of that in Shoppers World, where the parking lots are being colonized and downtown Mississauga is turning into a dense city center. Malls all across North America, through a combination of online shopping, so that it was, the pursuit of cheap wasn't leading people to malls, and it's not a great experience. And so I think there were reasons why we were seeing the atrophy of those regional malls. I think that will continue, maybe even be accelerated.
Jennifer?
Could I just pick up on the earlier question about downtowns, because I think this is a really critical question, and I agree with Ken's comments. The earlier call I was on, we're doing some cross-pollination here. The CEO of Gensler was also on that call, and they have just conducted a very extensive survey across America on the experience of working from home and what people hope for in the future. And interestingly, only 12% of respondents are interested, or maybe that is a high number, but 12% are interested in working from home moving forward in the future. 30% of the respondents were interested in a combination. And I think that's really a hopeful opportunity for cities moving forward in the future. If there is a combination, a blending of work scenarios, that will reduce the pressure on our transit systems. It will reduce the pressure on the congestion that we see in downtown environments, while at the same time still ensuring that we do have that vibrancy instead of the ghost town scenario that you mentioned, Brian. I think that there's, going back to what I said earlier about nothing set, like what the future holds is what we're going to make it. I think that still holds for work as well. But I also think when companies like Facebook and Twitter and Shopify say to their employees, like, we're over the psychological block of needing to see you every day, and we're perfectly happy with you just staying and working from home. I do think it really changes the workplace dynamic in a way that is difficult for us to anticipate. I also think that it's difficult for many of us to imagine what working from home looks like if it's something that's only been done under lockdown, because lockdown has other negative, harsh realities. But working from home in a non-lockdown situation has lots of benefits. You might work in the morning, then walk out and go for lunch with someone. You go out and see your friends in the evening. Very different from the way we're living right now. And I think sometimes when we talk about working from home, we might confuse it with the experience we're having in this moment, which is a lockdown experience, which is much more intense than just working from home. So I think the verdict is still out. I think that there's going to be a lot of pressure on cities like Toronto that have aggressively built and are aggressively building a significant amount of office space as we go through this transition of figuring out what the blended new normal is. But I think the blended new normal will be good for cities from an environmental perspective, from a quality of life perspective, and also in terms of the pressure on our transit systems, which was at a breaking point before we hit lockdown.
Just to pick up on that, I think the 9 to 5 radial commute with dormitory suburbs all focusing on one major CBD is likely to change in a bunch of healthy ways. I think people are going to spread out over the course of the day. They'll spend some time at home. They'll change their working hours. I think work is going to be more dispersed throughout the region, probably in a good way. And all that's going to sort itself out. But I think the enormous pressure, for those of you who are designing transit systems on the morning peak and the afternoon peak, that's likely to change. I think I can see those peaks spreading out and taking on a different form. Another thing I think is going to change, which again I think is a good thing, is a reduction of air travel. People either for mass tourism or for business meetings, feeling they have to jump on an airplane all the time. And I've been doing international work. I know Jennifer, you have as well. I love the idea that I don't have to go to those one-day meetings and spend hours and hours in airports at either end. And I can, once I get to know people, I can do more of the meetings like we're doing now with See and Share and with other devices. And I think people are going to be much more used to that and adept at doing that.
One of the things that Transit Alliance has talked about at our board level is that we want to potentially take some opinions, take some positions. In the past, we have taken positions from a transit or transportation standpoint. Given this current situation, funding that both Jennifer, you talked about, but Ken, you also touched on of transit, some of the things that people are planning on doing in the future, some of the changes that need to take place. Are there things that you two would recommend to Transit Alliance that we should take a active public position on?
Absolutely. The first I'll mention is in the 2020 declaration, which you can find at 2020declaration.ca. And the recommendations in there are all around decarbonizing our approach to transportation in cities and recognizing transit as being an essential service in cities. And as everyone on this call knows, we've had a deeply problematic approach to funding transit infrastructure in our country that has relied overwhelmingly on the fare box for operating revenues. Nothing has exposed the absurdity of that approach better than this pandemic, as ridership has gone down, but the need for the service by those essential workers who, quite frankly, have kept us fed and kept us alive, they've needed service, and all of us have needed those essential workers to be getting to the hospital, to be getting to the grocery store. We've relied on those essential workers, which is why they're called essential. Transit has been the foundation and the backbone of mobility for those essential workers. So the payment, how the system gets paid for, needs to be understood much more like we understand in how we pay for healthcare. And I think we need to take this moment and fundamentally upend our approach to how we approach funding operations for transit in cities. And we need to put in place a sustainable long-term approach that recognizes the critical service that transit is in our cities from a sustainability perspective, and moving towards our goal of decarbonizing our cities, but also in terms of ensuring that access to hospitals, to places of employment for essential workers is not compromised at any time, including in something like a pandemic. So that would be, I think, a very powerful space for the Transit Alliance to fill. And right now, municipalities have sort of been banging on the door of the federal government and saying, we need money, we need bailout money. The government's come to the table and is expediting some money that they had already promised earlier. But this question of how we've had a broken model for funding transit, we haven't wrestled that to the ground yet. We need to wrestle that to the ground, and we need to be having a conversation about that right now. And this language of transit as an essential service needs to become part of the mainstream, and we're not there yet. And it is something that we did put in the declaration.
I agree with all of that. And let me just add one thing that may not be immediately intuitive. And I think those of you in a transit alliance should also be very strong advocates for active transportation.
Yeah.
And the two go hand in glove. It very often has to do with the last mile or the last kilometer, or how people are accessing transit or combining active transportation with transit. I do it all the time. But also both of those together contribute to the decarbonization, to facing that larger existential crisis of climate change. And the worst thing that can possibly happen is we tilt away from this with a rejection of density, a rejection of city life, a rejection of transit, and that's all one big ball of wax. And it tilts us back to the auto-oriented paradigm of low-density sprawl, reliance on the automobile, and undermining all the efforts dealing with climate change. So I think, in the case of yourselves, making common cause with those who are advocates for cycling, for walking, for other ways of getting around the city, I think only adds to your argument.
Well, I want to thank both Ken Greenberg and Jennifer Keesmaat for joining us today, and thank all of you for joining us. It is a pleasure to chat with both Ken and Jennifer again. Ken was very involved in something I was organizing about a decade ago called the Mississauga Summit, and Jennifer Keesmaat was also involved at the time. And Jennifer, former candidate for mayor in Toronto, former chief city planner for the city of Toronto, has been a frequent visitor to Transit Alliance. So thank you for doing that. And Ken, hopefully we'll have you come back. Just for everyone's information, if you're interested in several of these topics, I've done a radio / video show with Jennifer Keesmaat, with Josh Cole, former chair of the TTC, with Caroline Mulroney, with QTRIC, which is the Canadian Urban Transit. So there's lots of those shows available either on the Transit Alliance website or my own website. And Minister Caroline Mulroney, Minister of Transportation, is committed to come. We haven't got a date yet, but come to a future Transit Alliance event. So hopefully all of you that have joined today enjoyed the conversation. We'll hopefully post this online. And for any of you that are interested in joining Transit Alliance, we rely on membership fees. Please consider doing so. Ken and Jennifer, thank you so much.
Hey, thank you.
You're welcome.
Thanks, everyone. Have a great evening. Good night. Are you going to say hello, Howard? Thanks for the introduction, Saba.
Brian, always great seeing you. So glad you had Ken and Jennifer. They were just great. Sorry I missed the first part, but just really, really top drawer. And your show last week was good too. So every week, just come back, do it. And I think it adds a lot of value. Love to have further discussions like this because it's a really good, needed format. And I hope we have a chance to have many more.
Excellent. Saba, thank you so much for starting it off.
No problem. Did you look at that declaration?
I have not.
It's really good.
Well, we'll have to consider it at our board.
Yeah. Well, I know it would align with what I'd want to do, but I'm not the only board member, so we'll see.
Excellent. Thanks very much, everyone. Good night.
Good work. Take care, guys.
Bye-bye.
Bye.